Dr. Abbas Mohammed here from Columbia Dental joining us. How are you?
Very good. How about you,
I'm
Brian?
good. I'm really good. My teeth feel good. Don't I mean? I feel like before we get to some of the other stuff, you know, are the mouths of people who are getting older in better shape? Take a 55-year-old male in 2025. Is his mouth in better shape than the 55-year-old male in 1995?
There are, put it that way, yes and no. Actually, probably our natural teeth or dentition is in a worse condition than 30 years ago, despite the advance of technology and everything else. And the reason is that has to contribute to the diet and food. So I remember when I was a student and at Columbia, one day I went to Natural History Museum in New York City, and I saw those skull, ancient people. And interestingly, I, didn't see any bone loss around the teeth. I didn't see any tooth loss on the skulls. But 80% of the adult population in United States currently has periodontitis or periodontal disease. So we see 80% of the bone loss around the teeth of adult population in United States currently. And the theory beyond it, it has to do with the diet and nutrition. So older days we use the teeth for harder food and mastication, and over time by innovation of the fire and now currently with the food processing industry, food are so soft, so we don't exercise with our teeth and with the ligament around our teeth.
So, what can people do to have healthier teeth even before coming to see you?
Well, there is a lot of things they can do. Of course, every dentist is advocate for brushing, flossing, go see dentist every 6 months. But something that really overlooked is the diet and nutrition. Unfortunately, that part had been overlooked, and even when I went on school, that was not part of the academic training. But as I go through more reading literature and go through more through continuing education courses, and I see and I gain practice by seeing the patient, I really see the importance of the habit and the diet, not only on the, of course, on the overall health that it is subject of a lot of conversations these days, on the media, but uh, that has to do also with the oral health. Lot of high processed food like Cheetos, potato chips, those are, they have a very bad deleterious effect, not on the oral, not health overall, but on the oral health condition.
I had no idea. I think that's a really great point. Now, at Columbia Dental, just take me through what makes Columbia Dental different than other places to go to get this.
A few things. First of all, in Columbia Implant Center that we are on in Manchester, Connecticut, we are open 7 days a week. We are open from 7 a.m. to 9 p.m. And also we are only private practice in Connecticut that has all the six disciplinary uh, the disciplinary of dentistry within in our Manchester location, from pediatric dentist to oral surgeon, prosthodontist, and so and so. And also we have our the lab and the digital laboratory, dental laboratory on premises. And what we can do in Manchester, Connecticut, on 7 days a week, we can perform and deliver the final product or prosthesis all at the same days.
You really cater to people who actually have jobs right? I mean, I think what's important to point out is at Columbia, people can go there when they're not working, or they don't have to skip work to get this stuff done.
Correct. Correct. That's our the majority of
Right.
our patients are.
So I'm going to do this for you, Jeff. Just describe it a different way. I'm going to ask the question and you can answer it. What's the reason why you go 7 days a week and you're open at night?
The reason is first of all that business model it works.
Why?
Why it works is because empirically I experiences is when I came to Manchester, Connecticut, 25 years ago. I started as a sole practitioner, and I was a basically single person, didn't have to do too much. Came from New York City to Connecticut, and coming to suburb, I got a very huge cultural shock. Didn't know what to do with myself, so I started working, not for any reason. It's just what was bored and wanted to work 7 days a week. But after that, I see how many patients are coming to me, and I saw my busiest day. It became Saturday and Sunday. So as the business needed other associate and provider, I built up the practice based on the model. So that why I did it. This is like something I discovered it by accident. Put it that way.
It's interesting because you would think that it's because you're catering to working folks, and it does do that, but that's not. You kind of got lucky to fall into that. You were just bored and wanted to work a lot.
Yeah, exactly, and it worked, and that model worked very well in Connecticut because I was the only one that did that.
Now, in terms of talk to me about the all-on-4 implants.
All-on-4 implant is a very innovative procedure. Older days, let's say there were people, we have a lot of people, they reach on a level that they feel that going again through more root canal and crown, gum disease, periodontal treatment is not worth it. So they end up to make the decision to remove the teeth. Older days, the only option that we had was a removable prosthesis or denture. So what we used to do in the older days, and still we doing it, is before we removing the teeth, we would take the impression, we make the denture ahead of the time, we remove the bad teeth, and we inserted the denture. With that denture, we call it immediate denture. The reason we call it immediate because we'll insert it immediately following the extraction. And now these days, with this procedure all-on-4, they don't have to go through the removable denture experience. What would happen? We remove the bad teeth, we place 4 implants, and they get full set of teeth supported by those 4 implants. So basically, they walk out the office with the fixed teeth that they're not coming out of their mouth. So it's a really life-changing. Within 3 hours, the life of the patient, it changed from having loose teeth, bad teeth, teeth that they are not aesthetically pleasant to very nice set of teeth, and they are not removable.
Can you just describe again the advantage of having the ability to do everything in one place?
The advantage is so the things can be done within a couple of hours. Any other places, they have to get referral from one place to the other place. So things that might take a couple of months in other places, in our location, it just takes few hours because everything is in one place.
Anything else that you think is important to bring up?
Not really. That's
Are you
I
good,
think
Jeff?
they
You
cover